Hello, and welcome to the 30-Minute Reels Employer Informational Series hosted by Marshall University's Office of Career Education. My name is Darby McLeod. I'm a student here at Marshall. Today I'm speaking with Ben Spurlock, who is a physician's assistant and works at the Physician Assistant Program at Marshall University's School of Medicine. How are you doing today?
I'm doing very well.
Okay, I wanted to start off with just a quick introduction.
Okay. Well, my name is Ben Spurlock. I'm a physician assistant, as she mentioned. I've been working in emergency medicine for the last 7 years, and just recently I transitioned into PA education with a developing Marshall PA program. But I still work clinically 1 day a week in an emergency room.
Oh, that's awesome. How'd you get started in this field?
Well, when I was attending Marshall, I was actually pre-med. My father was an RN throughout my life, and during college, I worked as an orderly in surgery. So I was talking to a lot of the residents, and I was on track to join med school, and I was hoping to become a surgeon. But some of the residents weren't really happy with their decision, and one of them on a night shift had mentioned becoming a physician assistant. So I started looking into it, and a few things about it really resonated with me. The fact that you have autonomy, but you still are working with a physician, so a team-based approach to medicine. He also let me know that if I decided to change specialties, instead of having to go through a whole different residency, I could just switch jobs because PAs are taught as generalists, and I like that kind of mobility. So that way I can change roles kind of throughout my life without feeling like I lost any steps.
Did you always know you were going to work in the healthcare field?
I had an idea, growing up with my father working in surgery, he would come home with stories. So I figured I'd go down that route either as a nurse or a doctor, and then the PA opportunity presented itself, and it's seemed to work out so far.
What would you say a typical day looks like for you?
Well, when I'm working in the emergency room, I typically get there about 30 minutes early for a 12-hour shift just to kind of get settled. Once I start seeing patients, the good thing about working in emergency medicine is there really is no typical day. You really see anything that comes through the door. So it can range from the regular chest pain, shortness of breath, and abdominal pain to some of the kind of crazy drama-filled Grey's Anatomy moments throughout the day too. So it keeps things interesting. Working in education now, my days are a little bit more structured, but the craziness of the ER is really something that's hard to describe.
What are the different settings in which people in this occupation may work?
Yeah, so that's one of the good things about being a PA is they've actually permeated all of medicine. So you can work in the emergency room, surgery, family practice clinics, seeing their own patients, and urgent care. You can also work in psychiatry. There are PAs that work in prisons as a primary care physician there. Also, I've had the opportunity of working at racetracks as sponsored events as part of the emergency medical team there. So you can really do a whole lot of different things, and you're not locked into any one thing, so you can actually change throughout your career.
Yeah. So you said you worked in, emergency?
Yeah, an emergency room.
Did you get to work under any other specialties, or was that just the one that you?
No, just the one. Of course, on rotations when I was in school, I got to get a little taste of just about every specialty, and emergency medicine. I was lucky enough to shadow at a place or rotate at a place that I got along with the staff, and I got to know a lot of mentors there.
Mm-hmm.
So a lot of the people that taught me in school were the people that I worked with for the better part of 7 years.
Yeah. Do you have a favorite setting of where you've worked at?
Well, the place that I spent the most time was Our Lady Bellefonte Hospital in Ashland, Kentucky. So that was actually the place that I rotated at when I was in school. They called me while I was still on rotations and told me, don't pick up anything. We want to have you when you graduate. And I worked there from the time I graduated until the time that the hospital unfortunately closed of April of this year. And then I've transitioned into another emergency room in Kentucky. So I've been very lucky because that was a dream job. And then, working in education now, building the Marshall PA program is just trading one dream job for another one.
What does a typical work schedule look like for you each week?
Well, when I was working in an emergency room, we did 12-hour shifts, and, weekly it changed, but most of the time I would pick up about 15 or 16 shifts a month. So that would usually be about 3 or 4 a week. I've always been an independent contractor, so whatever I worked is what I got paid for. Didn't get vacation time or sick time. So I would structure my work schedule to accommodate for any trips or anything I had. So I could work as many as 11 days in a row with a lot of time off later in the week. Or my typical would be 3 or 4 in a row with 2 or 3 days off.
Is this work schedule typical for this occupation, or does it differ by location?
Well, it differs mainly by specialty. And so emergency room, you can work 8, 10, or 12-hour shifts. And usually that includes days, nights, weekends, and holidays. So you're kind of spread all over the place. And that attracts a certain kind of person. If you wanted something more structured than family medicine and surgery, you usually work set number of hours a day. But those can also include call. One of the pluses of working emergency room is I never had to take call. Once my 12 hours was over, didn't have to worry about it anymore. But with family medicine, there might be weekend calls. Internal medicine, there's a lot of call. And then if you work with a hospitalist group, it might be 7 days on and then 7 days off. So if you're looking for something 9 to 5, there's something for you. And if you want something with a lot more time off, then emergency medicine or hospitalist would work out.
Would you say having a flexible schedule is important for this career?
Yes, yes. And that can change, as people get old. I was fairly young when I got out of school, so I was a lot more flexible. Priorities change as you get older with families and things. So starting off, especially when you're new, when still trying to learn more, being flexible, being able to pick up as many shifts as you can and spend the extra time learning is paramount to having longevity in the career. As things get more settled and you start, building a family or changing your priorities, then, you can kind of transition into something that's a little bit more structured. But ultimately, in any job. Are you there?
Oh, I'm sorry. You cut out on us for a second.
Oh, okay. Yeah, I'm sorry. You froze up on me too.
I'm so sorry. What would you say is the most rewarding thing about working in this industry?
In medicine in general, especially emergency medicine, you're seeing a lot of people on their worst days. So a lot of the things that were fulfilling for me was helping patients, especially people that were scared or worried or had, troubling diagnosis, helping them through that really bad period. All the thank you notes and, kids drawing you pictures really helps you get through the harder parts and the harder encounters. The other thing is just especially in emergency medicine, it takes a certain kind of person to work there. So being able to work with the nurses, the clerks, the doctors, the other PAs and nurse practitioners, phlebotomists, everybody in that setting, that can be stressful. The way that everyone comes together and gets really close was super rewarding to me. So.
What would you say is one of the most challenging things about working in this industry?
Well, besides just the general pool of knowledge that you have to have every day, again, you're giving some people some bad news. There's some hard cases, and just inherently there's loss. So there are cases that, inevitably you'll take home with you that's on your mind and, in your heart. And those are the worst days. But ultimately, even in the worst scenarios, you learn something from that so you can take that situation and carry it into the other encounters. And also it's really challenging to make sure that you don't miss any of the big stuff. So, and dealing with the business of medicine has never been something I've been very good at. So having to do insurance companies, all the things that you would.
Absolutely. What skills are most important to acquire, or what skills do job employers look for?
Well, so employers want you to be efficient. They want you to be knowledgeable. They want you to be strong on your own. But they also want you to be able to, especially in a PA role, be able to ask for help when you need to. Everyone wants to be quick, so you see the maximum amount of patients getting the best outcome, but you have to be able to know your limitations. The other side of that is what patients want, and they want strong communication. So being able to talk to them, PAs are lauded as being able to spend more time with patients. So being able to convey exactly what you're doing, why you're doing it, and ultimately what's going on with those patients in a way that they can understand. It served me well, and I think that most PAs would say the same.
How important is career development in college, like networking, mentorships, and job shadowing?
Well, I always suggest that people, especially if you're looking into anything in medicine, especially a specific role, is the best thing that you can do is shadow. It's easy to read about, what a position is, but it's something else to see it, see what the day-to-day is like. You might be surprised about the lack of downtime that you might think that some roles have, especially in emergency medicine. But seeing how they interact with other specialties, how some encounters with patients can go both good and bad, will let you know if it's something that's for you ultimately. So that would be the biggest thing. Networking, it always helps to know people, especially when you start floating your resume out there. I don't think that it's super paramount because you'll build those connections in graduate school, especially when you go on rotations. That's part of the good thing is you're kind of put into the situation where you're going to meet doctors, nurses, administrations. So I don't know how strong that is or as important that is in college, but all of that can end up helping you later on down the road.
What job search advice would you give to job seekers?
Ooh, there's so many resources out there. Just make sure that you're trying them all, especially with the internet in times like these. It's really easy to just fixate on one website and check there, but there's so many different websites and PA organizations that offer, job listings. Also just, asking around, because there might be positions that maybe are getting ready to be developed, or maybe they're entertaining trying a physician assistant out that they haven't tried before, like in an ER setting, or a doctor's looking for a little bit of help in their office. So just asking around, that's kind of the old school approach, but it might get you somewhere.
Yeah. You mentioned that you can look for jobs online. Are there any specific places where prospective PAs can look?
Yeah, so places, if you're looking for something in education, the PAEA website has those listed. NCCPA has resources listed as far as finding jobs. AAPA, which is organizations for physician assistants, have those. And then things like Indeed.com, Monster, things like that. Just a general Google search will get you to the right place.
What resume tips would you give to prospective job applicants?
Yeah, so resumes are always hard. I think the biggest thing that you want to convey is who you are, what your goals are. I've always utilized the cover letter probably more than maybe I should have to kind of let people know who I am. But it also lets you know your passion for what that employer is doing. And also making sure that you account for all your experiences. Me personally, I had only worked in that one ER for the span of my career, but it showed that, I was loyal. So I kind of listed out the values that that position allowed me to pursue, the things that I was responsible for there, and any accolades that I might have gotten there, just so employers knew, why my resume looked the way it is, because it's really your way of showing them who you are. So that would be my biggest piece of advice, is try to convey a little bit of who you are and what you're about in your resume, instead of just listing your experience.
So what is the hiring process like for someone entering this career path?
Well, I've been fairly lucky. My first interview was very informal. It was they had seen how I worked as a student and just brought me on board. Most of it is going to be fairly routine. You send in your application, you get the call, have a formal interview, talk about your experiences. The credentialing and the licensing processes you have to be prepared for kind of long processes. Getting credentialed at a hospital can take months, and getting your license together, as far as your full license, can take upwards of 6 months. So you want to make sure that you're prepared for that, especially as you're talking to people about jobs. But ultimately, being prepared for phone interviews, Skype interviews nowadays, and panel interviews is really important.
So what's the process of getting your license like?
Yeah, so it's state dependent. Um, you, for physician's assistants, you become nationally certified through an exam called the PANCE exam, and that gives you national certification. With being a physician assistant, your license has to be under a physician in most places. So you have to find a physician and a job and then apply for a license through the state. I worked in Kentucky, so that process, I was able to get a temporary license after only just a few months after taking my uh, national certification. And then to get my full license, it was about 6 months, but I was able to work in the meantime with my temporary license. So it can be long, and then you also have to get recertified. Nationally, you have to get recertified now every 10 years, and then I have to renew my state license about every 2.
Oh, that's not bad.
Yeah.
What are some common entry-level jobs in this field?
Well, do you mean experience-wise or when you're a physician assistant?
When you're a physician assistant?
Yeah, so once you graduate, you could go into just about anything. There's a lot of employers, especially now that physician's assistants are becoming a much more mainstream entity. You know, job growth over the last several years has gone up exponentially. So there's a lot of people that are willing to take graduates because ultimately they don't have any bad habits per se. So they're looking to groom them into a practitioner that, you know, follows their routines. So just being on the lookout for those kinds of jobs. But ultimately, once you're out of school, you're into it. So I was practicing right along with doctors and the other PAs on my first day, seeing patients and things.
Oh, wow.
They're a lot of places are understanding. So there's a lot of on-the-job training. So there's definitely an adjustment period for every specialty. But when you come out of school, you're doing the work.
No, that's awesome.
Yeah.
What does career advancement look like in this field? Are there different opportunities to advance?
Yeah, within a specialty, you know, you working in emergency medicine, you step up with experience and you kind of get paid according to that. A lot of models will have you topped off after a certain time. With different specialties, you know, time and experience will get you further. You know, within certain organizations, you can take a leadership role in your group of physician assistants, whether that's making the schedule or kind of, you know, coordinating things as a head PA. A lot of organizations will end up doing that. Moving forward, there are opportunities in certain specialties to do residencies. You can do those right out of school or even later on. That could make you more marketable, especially if you're in a community where things are a little bit more competitive. So give you a little bit more education on certain procedures. I know that there's emergency medicine residencies that PAs can take. It's a little bit of time. They're not obligated at all. They're not absolutely necessary. I was lucky enough where I didn't require one, but there's definitely an opportunity there. And then later on, like I said, you can end up switching specialties into something, you know, either more comfortable or more interesting to you. So that might not be, you know, the traditional step up advancement, but, you know, priority wise, it might be in improved livelihood or quality of living for that individual.
So you work at Marshall University School of Medicine. Is there any tips that you could give our Marshall students on what educators look for or might not want in a prospective PA student?
Well, I can't give you a whole lot of insider tips, but the general advice I typically give everybody is to, you know, make sure that you're checking our website. The faculty at Marshall has been great as far as the advisors go. We've actually been in contact with them, and we're trying to, you know, build the path that students can go down to make sure that they meet all the minimum requirements. That would be my biggest piece of advice too, is just make sure that your plan includes all the minimum requirements, whether it's GPA, GRE, taking all the prerequisites, because you want to make sure that you're competitive. The amount of applications, especially since we're a developing program, the response has been tremendous. So we're very proud of that. So I always suggest, if you have the opportunity, it's not necessary or required by our program, but in order to give the applicant an idea what they'll be doing to do that job shadowing. But just make sure that it's something that you want to do. And then as you're sending in those applications, the people that are really passionate about it, that's usually conveyed. There's a part of the application that's a personal narrative. So that's what people use instead of the cover sheet as far as to letting us know who they are and what they're about. And the biggest thing is I would make sure that's something you want to do, because that'll come organically if you feel it, through your application. So the other thing is where we're part of Marshall. If Marshall students or anyone else have questions, there's a way to contact us for those kind of questions. And I'm personally available through the website email of paprogram@marshall.edu, and we're fairly responsive. So any questions that anyone might have, you can always send them my way, Darby.
Thanks. What do you wish someone would have told you before you started this career?
That I would love it as much as I do. I hate being the cliche guy, but when you're in school and the amount of information that's hitting you, everything that you'll read about going to PA school describes it as drinking water from the fire hydrant, just with the amount of information, and you're really in it and you can't really see outside of it. But I wish I could have told myself that it would all be worth it, because all the stress probably would have melted away. And I wish I would have gotten on that track just a little bit sooner. Mm-hmm. But that would be the biggest thing. The difficulties that you have starting out in any career and the stress that you want to be good enough, I think that builds character. The worry about doing a good job makes you more careful. So I wouldn't trade any of that, but just knowing that things worked out in the end would always be good.
And lastly, what tips would you like to provide students at Marshall University?
Just pay attention to your advisors. Try to do as well as you can in those basic science classes, and try not to just study for those specific exams. Try to use that information, because a lot of that will help you do better in graduate school. Having gone to Marshall myself and being a son of Marshall, I would also suggest making sure that you're having a decent time while you're doing it. The load that science majors take can be arduous. So just taking that weekend with friends and enjoying yourself while you can, because of the stresses that happen when you enter grad school and the career path, make you wish you had a few of those days back. So taking a moment to enjoy those, that would be another suggestion I would have.
Well, thank you so much for those. Those were some great tips that you provided for us. And thank you again for sharing your career with students at Marshall University. It was great to experience a day in the life of a healthcare professional. Thank you again for participating. Oh, sorry.
Thank you for having me.
Thank you so much for participating in the series again, and have a great day.